Good day. My name is Lindsay Michelle Meyer,
And I'm Jana Muller.
and we're both from Ukwanda, the Center for Rural Health. The Center for Rural Health has been a part of the Faculty of Medicine and Health Sciences since 2001, when the then Dean of the faculty realized the need to train our undergraduate students in a context very specific to the needs of the population of South Africa. Ukwanda's focus primarily is on rural communities, away from the metropolitan. From our humble beginnings in Worcester, Ukwanda is now established in Ceres, Hermanus, and even Uppington. Uppington, I'm very happy about Uppington because that's where my roots lie. And therefore, from its humble beginnings of only 2 staff members, Ukwanda has now grown to having a staff component of more than 20. All people very passionate about training healthcare professionals within a context of South Africa, with a main focus of training them in a rural area, away from the tertiary hospital. Therefore, we train students not only in district hospitals or regional hospitals, but also in NGOs. Our primary focus is to partner with communities. But this is more than that. It is about students understanding the context in which they will then work once they have graduated. Partnership is not just a one-way thing. A partnership is when we establish real needs and understand what the community needs. And it's with this in mind that we started with our celebration. And this celebration, Jana will actually share more about.
So in 2013, on the Worcester Rural Clinical School platform, the students started service learning projects based on community need. These projects were developed individually from each of the programs, from human nutrition, speech therapy, occupational therapy, physiotherapy, as well as medical students. And these projects then were run independently with community partners. Because of the small nature of the rural clinical school sites, there was actually an interprofessional nature that inherently happened. And these projects morphed from discipline specific to more interprofessional, as well as more engaged within the community themselves. This is from 2013, and it's now 2021. So over a period of 8 years, we have had students working in the same communities on the same projects, which has resulted in a sustained engagement. As part of the service learning cycle, we have a period of celebration. And one of the innovations we have is a celebratory phase at the end of every year, where we hold an annual community partnership function. In 2013, we held our first community partnership function in Worcester, and it is now expanded to including 5 municipal areas across 2 provinces. And this includes 4 community partnership functions hosted every year.
It is with this that we demonstrate the plight and need of rural communities. But more importantly, for us in Ukwanda, it is about sharing and testing innovation, but it's also sharing our knowledge with a broader community, such as other universities, within South Africa, but also nationally, internationally, and NGO sector. So Ukwanda primarily is preparing healthcare professionals that are relevant and responsive to the needs of the community they are serving in.
The presentations that the students do for the community partnership functions are done in collaboration with the community partners that they work with. This is not just to show that the students are working with community partners, but also as an opportunity for our students to reflect on how much those community partners have taught them. And it's this collaborative presentation that we hold so dearly and that the students take so much from.
But it's morphed. And now we are doing relevant research that actually include community partners. I think one of the biggest successes that we've had was our community care workers. Our community care workers have become an integral part of our students' education. In actual fact, it is now where a community member now becomes the lecturer of health sciences students, something that is never done before.
And what this community partnership function has also afforded us is the opportunity to see how year after year after year service learning projects are actually sustained and how they've become more and more owned by the community over these years. So if I think of one of our community projects, which is run by a occupational therapy coordinator, it started off as a service learning project which involved students on the community platform working with young student learners and involved the development of a food garden. And over a period of time, the development of that food garden with community members has now become its own established non-governmental organization, which the community runs and they drive, and the students learn from them in the field.
But what we enjoy most of all is that the lessons that we've learned in Ukwanda have now been, I almost want to use the word, exported to the faculty, where now, here in the Cape Town Metro, we have community partnership functions.
Yeah.
But not only that, a lot of the innovation and distance learning, distance assessments are now being used in terms of developing the new curriculum, which is planned to be rolled out in 2022. So the story of Ukwanda is an ever-changing one. It is a story that we want to share. It is a story where we want to share a lot of the mistakes we've made, but also it is around sharing the successes that we've enjoyed. Thank you.
Thank you very much.